Have you ever thought about your bathing routine as a potential culprit behind skin aging and health issues? What if the very habit you've followed for years is secretly working against you as you grow older? Today we're diving deep into how your daily bathing practices could be accelerating aging and risking your health. Ladies, if you're over 70, you may be unknowingly making crucial mistakes with your bathing routine that could negatively affect your skin and overall well-being. Could something as simple as how often you shower be speeding up the aging process? Stick with me as we reveal 8 shocking facts that might just change the way you take care of yourself. What if everything you've been taught about maintaining a healthy skin routine was actually accelerating the aging process? In this video, I'll share key insights that could transform your self-care habits. Stay tuned, because these tips will make a difference in how you feel and look as you embrace your golden years. Have you ever stopped to think that the way you bathe could actually be harming your skin, your health, and even your longevity? You may feel confident that your bathing routine is perfectly fine, perhaps even flawless. But what if I told you that after the age of 70, everything you've been doing could actually be working against you? From accelerating skin aging to increasing your risk of infections, many women over 70 are unknowingly making crucial mistakes every day. Stick with me until the very end, because I'm about to reveal 8 shocking facts about bathing after 70 that could completely change the way you take care of yourself. Trust me, you won't want to miss a single one if you care about staying healthy and vibrant as you grow older. Before we dive in, it would mean a lot if you could like this video. Your support helps me continue to spread important lessons about healthy aging. If you haven't subscribed yet, I highly recommend you do, and turn on the bell so you never miss any of our valuable content. And if you enjoy the video, feel free to comment 1 to let me know, or 0 if there's something you didn't like, so I can improve the next one. Now, let's get started with the first surprising fact. Fact number 1. Bathing too often can age your skin faster. Let me ask you a personal question. How often do you step into the shower or sink into a warm bath? Is it a daily ritual? Perhaps you even shower twice a day because you've always believed that cleanliness is next to godliness. Or maybe you prefer a more balanced routine, bathing every other day to strike a healthy compromise between hygiene and convenience. Whatever your pattern, here's a reality check you might not have considered. If you're over 70 and still scrubbing down every single day, you could unintentionally be speeding up the aging of your skin. Yes, what you thought was a healthy habit might actually be working against you. Let's explore why this happens. As we age, our skin changes sometimes in ways we don't expect. It starts to thin, losing the plump resilience it had in our youth. It becomes drier as the body's natural oil production slows down to a trickle, and most noticeably, it becomes more fragile, almost like a delicate heirloom that needs to be handled with great care. These oils, known as sebum, act as a protective shield, locking in moisture and keeping our skin soft and supple. But after the age of 70, that shield begins to weaken. Your skin becomes more vulnerable to the harsh effects of daily life. Now, imagine this. Every time you lather up with soap and hot water, you're not just washing away dirt, you're also stripping away that precious protective layer, leaving your skin even more exposed. Does this sound like something you want to continue doing? As we move forward, let's take a deeper look into what's really happening to your skin as you age, and why this simple daily habit could be causing more harm than good. As we continue from the last point, let's think about how your skin used to feel in your younger years, vibrant, fresh, and full of life, like a beautiful rose with petals plump and glowing with moisture. Back then, daily baths might have felt refreshing, even necessary to maintain that sense of vitality. But as we age, that once glowing rose starts to transform. It becomes more like fine tissue paper or a delicate piece of silk, still beautiful, yes, but far more fragile and easily torn or crumpled if mishandled. Now picture this. You wouldn't dream of taking a coarse scrubbing brush to a silk scarf or soaking it in scalding hot water, would you? Yet, that's exactly what many of us do to our aging skin when we hold on to the same bathing habits from our 30s or 40s. You might be thinking, but surely I need to bathe every day to feel fresh, clean, and hygienic. That's a fair question, and here's what the experts, dermatologists who study skin health, have to say about it. For most women over 70, a full body bath or shower is only necessary 2 to 3 times a week. Let that sink in for a moment. 2 to 3 times, not 7. On the other days, a quick, targeted wash of the essential areas, think underarms, feet, and private areas, will do the job perfectly well. This method keeps you clean without overburdening your skin. But frequency isn't the only thing that matters. How you bathe is just as important, if not more so. Many of us reach for those strongly scented soaps, the kind that foam up luxuriously and leave a lingering fragrancy, or indulge in long, steamy showers that feel like a spa experience. But here's the problem. Those habits can really harm aging skin. Harsh soaps, especially those packed with chemicals and perfumes, strip away moisture even faster. Hot water? It saps your skin's natural oils, like a sponge soaking up water. The result? Skin that feels tight, flaky, and prematurely wrinkled. So, what's the alternative? Dermatologists recommend switching to gentle, fragrance-free cleansers. Look for mild, creamy formulas designed to cleanse without stripping your skin of its precious moisture. And when it comes to water temperature, aim for lukewarm, not piping hot. Keep showers short 5 to 10 minutes, max, rather than indulging in those long, luxurious soaks you might have enjoyed when you were younger. If you're still bathing like you did in your 20s, it's time to rethink your routine. Your skin isn't just along for the ride, it's depending on you to adapt and protect it as it changes. If you're still with me and finding these insights valuable, please comment 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you never miss any videos. Your support helps us continue creating content to inform and inspire you. Now, let's move on to the next fact. Fact number 2. Overbathing increases your risk of infection. If the idea that too much bathing can age your skin surprised you, then brace yourself. This next fact might just flip your assumptions upside down. This version should be more engaging, with a seamless flow from the previous section to the next, keeping the reader interested while providing more details for clarity. Let's pick up right where we left off, exploring the surprising consequences of overbathing. You might be thinking, what if I told you that bathing too often could actually increase your chances of getting sick? It sounds counterintuitive, doesn't it? We've always been taught that washing keeps germs away, that cleanliness is synonymous with health. But stick with me here, because the truth is far more complex and fascinating than you might expect. Your skin is not just a passive outer layer, it's a living, breathing fortress, your body's first line of defense against a world teeming with bacteria, fungi, and countless other microscopic invaders. The secret to this defense lies in 2 powerful elements: your skin's natural oils and its microbiome. Let's break that down. Your skin is coated in a thin film of oils, the same oils we discussed earlier, which act like a sealant. They keep harmful pathogens out while locking in moisture to protect the skin. But it's not just the oils that are doing the heavy lifting. Your skin is also home to a thriving ecosystem of trillions of microorganisms, including good bacteria that form what we call the microbiome. Think of these tiny allies as your personal security team, working hard to crowd out the bad guy's disease, causing bacteria and fungi preventing them from gaining a foothold. Together, these oils and beneficial microorganisms create a dynamic shield that's essential to your health. But here's where overbathing comes into play. Every time you scrub down with soap, especially the harsh kind, or linger under a hot shower, you're not just cleaning yourself, you're dismantling that protective shield. You're washing away the oils and wiping out those good bacteria, leaving your skin exposed and defenseless. It's like tearing down the walls of a castle and sending the guards home, only to wonder why the invaders waltz right in. For women over 70, whose skin is already producing less oil and recovering more slowly, this effect is even more pronounced. Overbathing doesn't just dry you out, it opens the door to infections. So, what kinds of problems are we talking about? Let's look at a few examples. Fungal infections are a major concern. When your skin's protective barrier is compromised, fungi like Candida culprit behind athlete's foot, yeast infections, or even stubborn rashes can easily take hold, especially in warm, moist areas. Then there's eczema and dermatitis. Overwashing can leave your skin raw, cracked, and inflamed, turning small irritations into painful, itchy patches that refuse to heal. And don't forget about bacterial infections. Without its natural defenses, your skin becomes an easy entry point for bacteria, which can slip through tiny cuts or fissures. This can lead to sores, boils, or even cellulitis, a deeper and potentially serious infection that requires medical attention. You might think, I'll just use antibacterial soap to kill the germs, right? Not so fast. Here's the catch. Many antibacterial products are like a double-edged sword. Sure, they kill some of the harmful bacteria, but they also obliterate the good ones, throwing your skin's ecosystem into chaos and leaving it more vulnerable than before. Studies have even raised concerns about this revised version gives more detail, engages the reader with a storytelling approach, and uses transitions to smoothly connect to the next section, setting up the reader for what's to come. Let's continue from where we left off, diving deeper into the hidden dangers of some common habits. So, as we were discussing earlier, overusing antibacterial soaps, which often contain ingredients like triclosan, can contribute to problems like antibiotic resistance over time, a health concern you definitely don't want to invite into your life. So, the next time you're tempted to hop in the shower, just because take a moment and pause. Your skin isn't begging for another wash, it's pleading for a break. By cutting back on overbathing and preserving your natural oils and microbiome, you're doing more than just avoiding dryness. You're empowering your body to protect itself. In this case, less truly is more. Less bathing means a more resilient skin barrier that can protect you from the outside world, keeping you safe and healthy. Now, let's shift gears and talk about something many of us take for granted, the hot shower. It's been a cherished ritual for as long as I can remember. The kind of long, steamy shower that fills the bathroom with thick clouds of fog, turns the mirror into a blank slate, and leaves you feeling like you just stepped out of a luxurious spa. There's something undeniably comforting about the heat wrapping around you, melting away the tension of the day. But here's a sobering reality I've come to understand. Once you hit 70, that beloved ritual could quietly transform from a soothing escape into a hidden danger. It's no longer just about preference, it's about safety. Let me break it down for you. The trouble begins with what hot water does to your body. When you step under that cascade of scalding water, your blood vessels respond by dilating, widening to help dissipate the heat. This is your body's natural way of cooling itself down. But here's the catch. When those vessels expand, your blood pressure takes a sudden dip. For younger folks, this might not be a big deal. The body can adjust fairly quickly. But as we age, our systems aren't as resilient. A drop in blood pressure can go from a minor inconvenience to a cascade of risks, especially in the bathroom. So, what happens when your blood pressure plummets too far? You might feel a wave of dizziness washing over you, or a lightheaded sensation that makes the room tilt. In the worst cases, it can even lead to fatigue, complete loss of control, as your body crumples to the floor. Now picture this. You're standing on a slick, wet surface surrounded by hard tiles and unforgiving edges. If you lose your balance, even for just a split second, the consequences could be catastrophic. Did you know that over 80% of falls among seniors happen in the bathroom? That's not a coincidence. The combination of slippery floors, disorienting steam, and that sudden dizzy spell creates the perfect storm. It's a recipe for disaster that's far too common. And let's talk about what happens if you do fall. After 70, a tumble isn't just a bruised ego or a moment you can laugh off. The stakes are much higher. A fall can result in a broken hip and injury that often demands invasive surgery, months of rehabilitation, and sometimes a permanent shift in independence. Or worse, a head injury, which could be far more serious and require immediate medical attention. So as much as we all enjoy those hot showers, it's crucial to recognize the risks they pose, especially as we get older. Perhaps it's time to reconsider the temperature, the duration, and the overall routine, all for the sake of your health and safety. Now, let's move on to another important fact. Fact number 4, the dangers of overusing hot showers and how to protect yourself. Are you ready to dive into the next safety tip? Let's keep the conversation going. Let's continue from the previous point where we explored the dangers of hot showers and the importance of safety. Now, let's delve into a crucial topic that often gets overlooked, the risks of falling and how to prevent injury. A fall in the bathroom, especially when stepping on a slippery surface or losing balance during a hot shower, can be more than just a minor slip. Striking the edge of a sink or the floor can lead to concussions, brain bleeds, or other life-threatening trauma. As we get older, our skulls and brains become more vulnerable to injury, making these accidents much more dangerous than we might think. Even if the injuries aren't immediately severe, the aftermath can include chronic pain, reduced mobility, or a reliance on a walker or wheelchair. One simple misstep in the shower could rewrite your entire future. If you're someone who craves that piping hot rinsey, or if you know a senior who does, here's how to keep this beloved ritual safe without sacrificing comfort. First, dial back the heat. Aim for warm, not scalding water. Think of a temperature that feels pleasant, but doesn't leave your skin flushed or angry red. If you step out of the shower looking like a lobster, it's a sign that the water is too hot for your body to handle safely. Next, make your bathroom a fortress of stability. Install grab bars near the shower entrance and along the walls. These should be sturdy, reliable anchors you can grip if you feel even the slightest wobble. Consider a shower, stool, or chair. Sitting down during your shower transforms bathing from a balancing act into a secure, stress-free experience. Finally, here's a critical tip. If dizziness strikes mid-shower, don't tough it out. Lower yourself to the floor or stool immediately. Take slow, deep breaths and call for help if you don't recover quickly. Your safety isn't worth the risk of pushing through a moment of dizziness, so always prioritize it over finishing the task. If you're still watching and finding these insights valuable, please comment 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any future videos. Your support helps us continue creating valuable content to inform and inspire you. Now let's move on to fact number 4. Your feet need special attention. Most women I know invest a lot of time and care into their faces. We slather on moisturizers to keep the skin soft, dab on serums to fend off wrinkles, and even splurge on luxurious eye creams to banish dark circles. It's a routine we've perfected, a small act of self-love that we rarely skip. But let me pose this question. When was the last time you gave your feet the same level of devotion? I'm not talking about a quick scrub in the shower or a rare pedicure. I mean giving them the care they need day in and day out. As we age, our feet, often overlooked, become a critical part of our health. Neglecting them can lead to surprising problems, and here's why this matters more than you might realize. As the years go by, circulation in your extremities, especially your feet, starts to slow down. blood doesn't flow as efficiently as it once did, which means small cuts, scrapes, or irritations take longer to heal. This sluggish healing process can turn your feet into a prime target for health problems. If you're not washing and drying them properly, bacteria and fungi can settle in, causing even bigger issues. Let's dive deeper into how this can affect your overall health and the simple steps you can take to care for your feet, because they truly deserve the same love and attention as your face. This version flows naturally from the previous section and seamlessly introduces the next topic, ensuring the audience remains engaged and informed. Let's continue from the importance of foot care as we age. Now, let's shift our focus to another often overlooked area: the proper care of your feet and how neglecting them can lead to serious problems. As we discussed before, poor foot hygiene doesn't just lead to unpleasant odors, it's a direct invitation to infections that can spiral out of control. The biggest offenders? Fungal infections like athlete's foot, which thrive in the warm, damp nooks between your toes. If you're not drying thoroughly after a shower or a sweaty day, that trapped moisture becomes the perfect breeding ground for fungi. Left unchecked, you might notice itching, redness, or peeling skin uncomfortable at first, but potentially worse if it progresses. For seniors, especially those with diabetes or compromised immune systems, damp feet can even lead to ulcers, painful, slow-healing sores that may require medical attention. And don't overlook your toenails. If they're not trimmed properly, cutting them straight across and not too short, they can become ingrown, digging into the skin and creating another entry point for bacteria. Suddenly, those feet you barely think about become a health hazard. Even if you're only bathing a few times a week, your feet need consistent daily TLC. Here's how to build a simple yet effective routine to keep them healthy and happy. Start with a daily wash-shevin on days you skip a full shower. Grab a basin or stand in the tub and use mild soap and warm, not hot water. Gently scrub away dirt and sweat, paying extra attention to drying. Don't just swipe a towel and call it done. Pat them dry and then take a moment to wick away every drop of moisture between your toes, because that's where trouble loves to hide. Next, moisturize the tops and soles to prevent cracked, dry skin. Heels that split open can be painful and prone to infection, but skip the lotion between your toes. Excess moisture there fuels fungi. One more thing to watch for. If your feet start to ache, swell, or tingle, don't brush it off as just a normal part of aging. These could be red flags for poor circulation or nerve issues, both of which become more common as we get older. A quick check-in with a doctor might catch a problem early. By giving your feet this kind of deliberate care, you're not just avoiding infections, you're ensuring they can carry you through life with strength and comfort for years to come. Now let's dive into fact number 5. Your private areas need a different kind of care. This is a subject that many people shy away from discussing, often due to embarrassment or because it's simply not a topic often brought up in casual conversation. However, understanding how to properly care for your intimate areas after the age of 70 is crucial. It's not just a minor detail of personal hygiene, it's a cornerstone of comfort, health, and overall well-being as you navigate the changes that come with aging. Ignoring this area can lead to serious consequences. The truth is, your private areas undergo dramatic transformations after 70. If you're still relying on the same cleaning methods you used decades ago, say in your 30s or 40s, you could be unknowingly disrupting your body's natural balance and causing more harm than good. Let's take a deeper look at why proper care is vital at this stage and the steps you can take to maintain both comfort and health. This version creates a smooth transition from foot care to the next important health topic while maintaining a warm, conversational tone that's both informative and engaging. Let's continue from where we left off, discussing the importance of proper care for intimate areas as we age. This topic is crucial to understand as it directly impacts your overall comfort and well-being. As we get older, many aspects of our intimate health undergo significant changes. These shifts might seem subtle at first, but they can gradually affect your daily life in ways you may not expect. If you're not paying attention to these changes, what might start as a minor issue could evolve into persistent discomfort, recurring infections, attention, and don't overlook your toenails. If they're not trimmed properly, cutting them straight across and not too short, they can become ingrown, digging into the skin and creating another entry point for bacteria. Suddenly, those feet you barely think about become a health hazard. Even if you're only bathing a few times a week, your feet need consistent daily TLC. Here's how to build a simple yet effective routine to keep them healthy and happy. Start with a daily wash even on days you skip a full shower. Grab a basin or stand in the tub and use mild soap and warm, not hot water. Gently scrub away dirt and sweat, paying extra attention to drying. Don't just swipe a towel and call it done. Pat them dry, and then take a moment to wick away every drop of moisture between your toes, because that's where trouble loves to hide. Next, moisturize the tops and soles to prevent cracked, dry skin. Heels that split open can be painful and prone to infection, but skip the lotion between your toes' excess moisture, there fuels fungi. One more thing to watch for. If your feet start to ache, swell, or tingle, don't brush it off as just a normal part of aging. These could be red flags for poor circulation or nerve issues, both of which become more common as we get older. A quick check-in with a doctor might catch a problem early. By giving your feet this kind of deliberate care, you're not just avoiding infections, you're ensuring they can carry you through life with strength and comfort for years to come. Now let's dive into fact number 5. Your private areas need a different kind of care. This is a subject that many people shy away from discussing, often due to embarrassment or because it's simply not a topic often brought up in casual conversation. However, understanding how to properly care for your intimate areas after the age of 70 is crucial. It's not just a minor detail of personal hygiene, it's a cornerstone of comfort, health, and overall well-being as you navigate the changes that come with aging. Ignoring this area can lead to serious consequences. The truth is, your private areas undergo dramatic transformations after 70. If you're still relying on the same cleaning methods you used decades ago, say in your 30s or 40s, you could be unknowingly disrupting your body's natural balance and causing more harm than good. Let's take a deeper look at why proper care is vital at this stage and the steps you can take to maintain both comfort and health. This version creates a smooth transition from foot care to the next important health topic while maintaining a warm conversational tone that's both informative and engaging. Let's continue from where we left off, discussing the importance of proper care for intimate areas as we age. This topic is crucial to understand as it directly impacts your overall comfort and well-being. As we get older, many aspects of our intimate health undergo significant changes. These shifts might seem subtle at first, but they can gradually affect your daily life in ways you may not expect. If you're not paying attention to these changes, what might start as a minor issue could evolve into persistent discomfort, recurring infections. We age, it becomes even more vital for overall well-being. Let's explore why hydration should be a priority for you. This version continues the narrative smoothly, offering a deeper look into intimate healthcare as we age, while keeping the tone conversational and relatable. It also provides a smooth transition into the next section. Let's pick up where we left off, discussing the delicate care required for intimate areas and the importance of a gentle, minimal approach. As we continue, let's talk about something that might surprise you. How the way you wash can sometimes do more harm than good. When it comes to drying off after bathing, resist the urge to rub the area dry with a towel. Friction is your enemy here. Instead, gently pat the skin with a soft, clean cloth to wick away moisture without aggravating the delicate skin. This is a subtle, yet crucial step in protecting your health. Now, here's a counterintuitive twist that might catch you off guard. Washing too often or too aggressively can actually amplify odor rather than eliminate it. You might assume that more scrubbing equals a fresher feeling, but the opposite is true. Overwashing disrupts the microbial harmony in your intimate areas, killing off the good bacteria that naturally keep odor-causing culprits at bay. When those bad actors take over, you're left with a vicious cycle washing more in an attempt to fix a problem that washing itself created. If you've ever stepped out of the shower only to feel less fresh, or worse yet, noticed itching or discomfort shortly after, it's a sign that your routine might need a rethink. The golden rule here is simple: less is more. A gentle, minimal approach keeps your intimate areas healthy, comfortable, and naturally balanced, allowing your body to do what it's designed to do without interference. If you're still watching and finding these insights valuable, please comment 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any of our upcoming videos. Your support helps us continue creating content that informs and inspires you. Now let's move on to fact number 6. Hard water can secretly sabotage your skin and hair. Picture this: you've just finished bathing, diligently applied your favorite moisturizer, and yet your skin still feels tight, itchy, or scaly like it's crying out for relief. Or maybe your hair, once vibrant, now looks limp, brittle, or dull. No matter how much conditioner you slather on, your skin and hair seem to reject your efforts. Before you toss out your skincare or hair care products in frustration, consider an often overlooked culprit: the water flowing from your tap. Hard water, laden with high concentrations of minerals like calcium, magnesium, and sometimes iron, might be silently undermining your efforts to maintain healthy skin and hair. Most people don't give a second thought to the quality of their bathing water, but for women over 70 whose skin and hair are already more vulnerable, hard water can be a game changer in all the wrong ways. Let's unpack how hard water wreaks its havoc. When you shower or bathe in hard water, those dissolved minerals don't just rinse away, they leave behind a subtle, stubborn residue on your skin. This film acts like a barrier, preventing soaps and cleansers from fully washing off. Instead, you're left with soap skooma chalky, sticky layer that clogs pores, saps moisture, and leaves your skin feeling rough, dry, or irritated. For anyone prone to conditions like eczema, dermatitis, or psoriasis, this is a recipe for disaster. The mineral buildup exacerbates inflammation, intensifies itching, and sparks flare-ups. This version keeps the narrative engaging and provides helpful insights into skin and hair care, while smoothly transitioning into the next important topic. Let's continue from the previous section, where we talked about the hidden dangers of hard water and how it can affect both your skin and hair. Now, let's explore how these effects can be managed with a few simple changes to your routine. As we saw, hard water can be particularly damaging to aging skin. Over time, its effects compound, making skin even more prone to dryness, irritation, and loss of elasticity. For women with already delicate skin, the minerals in hard water can make matters worse. But the damage doesn't stop at the skin's surface. Hard water also targets your hair, depositing minerals onto your scalp and strands. This buildup weighs hair down, making it look flat and lifeless, while stripping the natural oils that keep it soft and shiny. Over months or years, this can turn hair brittle, exacerbate breakage, and even accelerate thinning again, especially frustrating concern for many older women already dealing with age-related hair loss. The good news? You don't have to simply accept the tyranny of hard water. There are practical steps you can take to fight back. Start with a shower filter. This budget-friendly device screws onto your shower head and traps those pesky minerals before they reach your skin and hair. Available at most hardware stores or online, these filters can significantly improve your bathing experience, leaving you with softer skin, less irritation, and hair that feels lighter and more manageable. Next, rethink your cleanser. Traditional bar soaps often react with hard water's minerals, forming more scum and amplifying the problem. Instead, opt for a gentle, pH-balanced, sulfate-free body wash or moisturizing cleanser. These products are designed to rinse cleanly, even in challenging water conditions. Timing also matters. After bathing, don't wait for your skin to air dry, which allows that mineral residue to settle in. Instead, apply a rich moisturizer while your skin is still damp within 3 minutes of stepping out of the shower. This locks in hydration and creates a protective barrier against hard water's drying effects. Here's a bonus tip. If your hair has taken a hit from hard water, consider using a weekly clarifying shampoo to remove mineral buildup. Follow it up with a deep conditioner to restore softness. While you may not control your city's water supply, these tweaks can shield your skin and hair from its harsh reality. Now let's move on to fact number 7. Taking a bath before bed can help you sleep better. If restless nights have become your unwelcome companion, whether it's trouble falling asleep, staying asleep, or waking up feeling less than refreshed, here's a gentle, scientifically tested remedy that could transform your evenings: a warm bath before bedtime. This isn't just about pampering yourself, though it certainly feels that way. A warm bath is a scientifically backed strategy to help your body and mind wind down, leading to deeper, more restorative sleep. You might pause and think, wait, didn't you caution against hot water earlier? And you're absolutely right. Steaming hot showers or baths can pose risks, especially for older adults, by raising heart rate or causing dizziness. But a warm bath, kept at a comfortable lukewarm temperature, is an entirely different experience. It's a safe, soothing ritual that taps into your body's natural rhythms to ease you into slumber. Here's the science behind this sleep-enhancing trick: your body. This version builds on the previous section, reinforcing the practical steps for managing hard water's effects, and smoothly transitions into the next topic about the benefits of a warm bath before bed. It's engaging, informative, and sets the stage for further exploration. Let's pick up from where we left off, talking about the benefits of a warm bath before bed. It's more than just a luxurious indulgence, it's a scientifically backed strategy to improve your sleep. Your body's temperature naturally fluctuates throughout the day, dropping slightly in the evening as a cue to sleep. When you soak in warm water, ideally around 98 to 100 degree Fahrenheit, just above body temperature, your core temperature rises. Then, as you step out and dry off, your body cools down rapidly. This process mimics and amplifies that natural evening dip, signaling your brain to release melatonin, the hormone that governs sleep. This helps you fall asleep faster and sleep more soundly throughout the night. Beyond just temperature, a warm bath works wonders on both the physical and mental fronts. It relaxes tense muscles from a day of gardening or simply sitting too long, and it eases joint stiffness, a common barrier to getting comfortable in bed. It also dials down stress and anxiety, which often plague older adults and sabotage sleep. The warm water triggers your parasympathetic nervous system, lowering cortisol levels and fostering a sense of calm that carries you into the night. To maximize this ritual, timing is key. Take your bath 1 to 2 hours before you plan to turn in. Any closer, and your body won't have time to cool down enough to trigger sleep. Any earlier, and the effect might wear off. You can elevate the experience even more by adding a few drops of lavender essential oil to the water. Its scent has been shown to slow the heart rate, relax muscles, and quiet the mind, amplifying the bath's calming power. Keep the water lukewarm, not scalding. You should feel cozy, not sweaty or flushed, when you step out. Too hot, and you risk feeling energized rather than drowsy, which defeats the purpose. Pair this with a consistent bedtime routine-dim lighting, a good book, and you've got a recipe for nights that leave you feeling refreshed, not frazzled. If tossing and turning has been your norm, this simple, low-cost tweak could be the key to unlocking the restful sleep you deserve. If you're still watching and finding these insights valuable, please comment 4 below to let me know you're here. If you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any of our upcoming videos. Your support helps us continue creating valuable content to inform and inspire you. Now, let's move on to fact number 8. Your bathing habits can affect your heart health. Here's a sobering truth that might catch you off guard. The way you bathe can have a profound impact on your heart, especially after 70. This isn't something most people associate with their daily rinse, but for women with conditions like high blood pressure, heart disease, or compromised circulation, bathing habits can either support or strain your cardiovascular system. As we age, our hearts naturally lose some of their resilience. Seemingly small choices like water temperature or the duration of your bath can tip the scales in ways you might not expect. Understanding this connection could mean the difference between a relaxing soak and a risky one. This version enhances the previous section by emphasizing the science behind a warm bath's benefits while smoothly transitioning into the next topic about how bathing habits can affect heart health. It's engaging, informative, and sets up the next point seamlessly. Let's continue from where we left off, exploring the crucial relationship between bathing habits and heart health. As we discussed, sudden temperature extremes can pose serious risks, especially for older adults. Now, let's take a deeper look at these dangers. When you step into a bath that's too hot, say above 104 degrees Fahrenheit, your blood vessels dilate rapidly as your body tries to cool itself. This process causes your blood pressure to drop suddenly, which can leave you feeling dizzy, disoriented, or even put you at risk of fainting. This can be especially dangerous if you're alone or unsteady on your feet. On the flip side, ending your bath with a cold rinse, something that some people swear by for energy, causes your blood vessels to constrict just as quickly, spiking your blood pressure and forcing your heart to pump harder against the increased resistance. For a healthy young heart, these shifts might just be a minor blip. But for an aging heart, these changes are a stressor that could trigger chest pain, palpitations, or even worse, a heart attack. But that's not all. There's also the risk of lingering too long in hot water. Soaking for 20, 30, or even 40 minutes might feel luxurious, but it further dilates blood vessels, reducing blood flow efficiency and oxygen delivery to your brain and heart. The result? Lightheadedness, shortness of breath, or a foggy feeling that signals your body is under strain. Protecting your heart while bathing doesn't mean giving up the ritual altogether. It's about doing it smarter. Stick to warm water, around 98 to 100 degrees Fahrenheit, avoiding the extremes of scalding hot or icy cold to help keep your blood pressure steady. Cap your bath time at 10 to 15 minutes, long enough to relax, but short enough to avoid overtaxing your system. When you're ready to get out, don't spring up like you did in your 20s. Stand slowly, gripping a sturdy grab bar or the tub's edge to stabilize yourself as your circulation adjusts. If you have a shower bath combo, consider sitting on a bath chair to minimize the risk of falling. Most importantly, tune into your body signals. If you feel faint, weak, unusually warm, or short of breath mid-bath, don't push through. Get out, sit down, and rest immediately. Your heart has been with you for decades, and a few mindful tweaks to your bathing routine can help ensure it stays strong and healthy. So there you have it, ladies. We've just walked through 8 shocking facts about bathing after 70 that might have completely changed the way you think about your daily routine. From how overbathing can age your skin faster to the surprising risks of hot showers, and even how a warm bath before bed could help you sleep better, there's so much to take in. I hope these tips leave you feeling empowered to care for yourself in a whole new way as you navigate your golden years. Now let's pause for a moment. What have you learned so far? I'd love to know what stood out to you the most. Maybe it's cutting back on those daily showers, giving your feet some extra love, or switching to gentler cleansers to protect your skin. Whatever it is, I want to hear from you. Please drop a comment below and share one thing you've learned today that you're excited to try. This version maintains a smooth and engaging narrative, while also providing actionable advice. It sets up the transition to user interaction and invites the audience to reflect on the content, enhancing viewer engagement. Let's wrap things up with a reminder of the power of small changes and their big impact. We've covered a lot of ground today, and it's amazing how simple tweaks to your routine can make such a significant difference in your overall well-being. If you found this video helpful, I'd be so grateful if you could take a second to leave your comment below. It helps us connect and keeps this conversation going. Your thoughts and feedback are incredibly valuable. While you're at it, don't forget to hit that like button, share this with a friend who might need these tips, and subscribe to our YouTube channel so you never miss out on more practical advice to live your best life. Thank you so much for watching, and I can't wait to see you back here for the next video. Until then, take care of yourselves, you truly deserve it. This version maintains the flow, encourages engagement, and seamlessly transitions to the end of the video, while also leaving the viewer excited for the next one.